Welcome to Peer2Peer, the podcast, brought to you by Rayner. Listen in as we hear from top surgeons having great conversations with their peers about hot and popular topics in ophthalmology. In this special episode of Peer2Peer, the podcast, renowned surgeons Dr. Roger Zaldivar, Dr. Filomena Ribeiro and Dr. Joaquín Fernández Pérez gather at the 25th Congress at FacoElche in Spain to discuss the key takeaways from Rayner's clinical symposium on optical quality and patient satisfaction and interesting and exciting trends covered at this year's event. Dr. Filomena Ribeiro is the head of the Department of Ophthalmology at the Hospital de Luz in Lisbon, Portugal. Dr. Roger Zaldivar is the CEO of the Instituto Zaldivar in Mendoza, Argentina. Dr. Joaquín Fernández Pérez is the CEO and Medical Director of the Ophthalmology Department at Q Vision in Vizas Virgen del Mar Hospital in Spain. Let's listen in.
Welcome Dr. Zaldivar, Dr. Ribeiro and Dr. Joaquín Fernández. How long have you been coming to FacoElche and what makes it such a great congress?
Well, I am coming for 10 years approximately, and I really think that this meeting I'll be coming in a Latin American and Iberia meeting. It's the meeting point for all of us to see us, to share all the knowledge that we are acquiring with our experience and the evidence. And I think it's the strength, and also not only talk about the science, the evidence, but also something that could worry about the profession and market. I really think it's a 360 degrees cover of the professional and the science of the ophthalmology.
Thank you.
This is my first time in FacoElche. It's been a wonderful experience. I had the information of my father coming many years. He was able to come actually the first or second time, and the evolution of this meeting is superb. As my good friend Joaquín was saying, it's not only about the knowledge of the European community, also this is strengthened by the Latin American community. That this is by far one of the most important meetings in the world, and I'm very happy to be here.
Well, I think I'm coming for 10 years, almost 10 years, something like Joaquín. And the truth is that this is not only a congress. This is a sharing experience. This is a true scientific community, sharing ideas, innovation, experience, also, of course, evidence. But this is growing like a community, not a congress.
Another question for all of you. Are there any new trends and topics you are seeing across the presentations?
Well, I really think that the trends is creating here in this type of meeting in FacoElche, of course, in the ESCAR, another meeting that we have. But more and more, I think that all of us are creating the trends, not as the industry. I think this is a very good option. I have the opportunity of the leadership of the trends based on the ophthalmology and the patient needs. And more industry, I think that they are trying to adapt to these needs that we are having in the clinical practice. Probably the diagnostics is improving incredibly, and also the profiles, optical profiles of the intraocular lens for simultaneous vision is an explosion of develop. So these two fields, I think, we are having improvement right now.
Yeah, this meeting is absolutely in the cutting edge of every single space in the field. I'm impressed with the amount of options that we have today regarding IOL technology, and I was very happy to see here the importance that software is gaining in the field. We had the chance to see the development done by Joaquín regarding the selection of different technology, considering evidence-based publications, which will truly be very useful for us to be able to select the best option for each patient. And there are other projects down there, all of them focusing in getting the best information to assist better the patient based in software. So I'm really looking forward to this technology.
I also would like to remark the work of Joaquín doing all the functional classification of all the options of the optical designs that we have right now to try to provide and fit our patients with a good functional vision. And this is an amazing work that for sure will make a big step for all the ophthalmologist community to understand and give the more personalized value for these options that we right now have for our patients. Of course, we need also to talk about digital health. And we had a great presentation, Dr. Roger Zaldivar with the project RUVI, which is an amazing instrument for all of us.
Dr. Ribeiro, you participated in Rayner's symposium yesterday on optical quality and patient satisfaction. Tell us what the speakers were reporting and your key takeaways for surgeons that were unable to attend.
Well, I really think that the key message right now is that there is always a solution to provide our patients and to address presbyopia correction in cataract surgery, and we need to attend that. And from enhanced monofocals to extended bifocals or trifocality, we have always the ability to choose the best solution for our patients. And of course, we need to manage the expectations of our patients. And this symposium was all about that.
There was a lot of talk in the symposium about Ray1 EMV. Roger, I know that you have been using this enhanced monofocal IOL a lot. What are your thoughts on it? What kind of outcomes have you been getting?
I consider this a new kid in the block that actually they have a couple of years now of published data and evidence, and it's very useful for our practice because it allows us to add value to our patients that wanted to be more spectacle independent, have a more functional vision in their daily activities, and we were forced in the past to only pick between two options, either be 100% far or with another strategy for micromonovision or monovision, or for multifocality based in diffractive optics that we know it's very picky technology in terms of sensitivity, of contrast sensitivity. You have to have good tear film, good macula and all other conditions. So in patients that weren't fitting in that space, we didn't have any option. Today we have this second option that is very important, and we do it in most of the people that want to have functional vision without having such a sacrifice in different aspects, night driving and different stuff.
To cover your target refraction for Ray1 EMV toric, and which IOL do you select when targeting emetropia, for example, first minus, first plus, or closest to zero?
Choose the second minus, first or second minus, depending on the willingness of the patient and they want to be more proactive in far vision or near intermediate vision, but always between those two options.
And last question for all of you. We are increasingly using digital health to support our practices and improve patient outcomes. What digital health tools are you using or interesting to start using?
Well, I was waiting for that question because I'm absolutely in love with the work of Roger with RUVI. I really think that in the future we are going to need more software that could create some collaborative effort. In the past, all our effort, all our knowledge, this was acquired in our experience and based on evidence. You need to read literature, you need to go to a meeting, to Congress. Right now, with this collaborative big data, we could have improvement of our knowledge, collaborating with other companies and developing application app ad hoc for any of the subject that we could have in our daily practice. So I absolutely love, we would like to acquire as soon as possible, because for us it's going to be a big step forward in our daily practice.
I want to congratulate the efforts done by Rayner regarding Ray Pro, the app, because patient-reported outcomes is definitely something that we have to see in detail, and the job that you have done facilitating that tool to physicians is absolutely critical to understand what the patients are feeling and to have a very comprehensive system to have the data in a very easy way. So thank you very much for your effort and for allowing us to understand all these important topics.
Well, I think what we can take from this conversation is that doctors and manufacturers, they all are trying the best to have good digital health solutions. And it's true, Ray Pro is a very good solution also to provide us to combine all the objective outcomes with the patient report outcomes. And this is truly a step for the develop of all the kind of solutions that we have.
The most important thing in the future is to be able to integrate. The interoperability of all these solutions will be the best, and where our patient will have the better results. If we are able to collect data from Joaquín, integrate it with the clinical part, with Revi, and then be able to gather all the information coming from the patient with the PRO, and everything gets to one single solution, that's where the magic happens. And there's where we have to be hitting, and I'm happy that we have a very nice relationship with Rayner, with leadership, with Joaquín, and I'm convinced that we will all move towards that interoperability of solutions where truly we'll get the most value from.
Yes, I really think that the patient-reported outcomes is going to be a more important point in research, because all these are the outcomes that we need to know. We really need to know, not the outcome that we expect to be important, but exactly the outcome that report by the patient. But of course, we need to take from the research. Probably in the daily practice, some doctor could have a distance because they could think that give the patient the option of openly to talk about the outcomes or the feelings could be a barrier. But for sure, this is a situation that we need to explore more and more. Even if we could listen from the patient something that we don't like exactly, but we need to ask, because we are going to improve the knowledge, try to improve the satisfaction of future patients.
Well, I think that all the surgeons they can see the value of these kind of solutions, of course, and we see that they will be there in the future for sure. What we need to improve right now is the automatic input of data, that is mandatory, and connection between instruments, for instance, in order to have all the biometric data of the patients. This kind of connectivity, we need to go a little bit more in developing solutions, universal solutions for all the instruments, and also the automatic input of data.
PRO is absolutely correlated, highly correlated to the prior state of a patient. If a patient has a hard cataract and then they go through a surgery and they have an acceptable result, the patient is going to be very happy. If the patient is a refractive procedure, no cataract nor anything, as Joaquín has described, with a very low OSI, objective scatter index, it's much more demanding in results. So that's why I'm saying that the relationship between all the solutions is going to add the most value, because understanding the clinical part, correlating that with the outcomes, the PRO, is going where we're going getting the most of for us of evidence to take real decisions. If not, things can be somehow biased. But the tools are there, and it's all about working together and connecting.
Thank you very much. Thank you all for joining Rayner's podcast, and I hope to see you next year.
Thank you.
Thank you.
Thank you.
In the next episode of Peer2Peer the podcast, we'll be crossing the English Channel to Germany, where our next host, Professor Gerd Aufarth, will be speaking with fellow surgeons from Germany and Australia about the benefits of different IOL materials, biometry tips and tricks, and do's and don'ts with toric lenses. For more information about this episode's topic and to read the show notes, visit the Peer2Peer hub at rayner.com/peer-to-peer. This podcast is provided for general information purposes only. The presenters' views are their own. Rayner does not endorse off-label use. Users must refer to the product labelling and instructions for use for Rayner products in all cases. Not all Rayner products are available in all countries. The full disclaimer can be found in the show notes.